School of Humanities and Sciences of Raffles University. I welcome everyone. Today, it's my great pleasure to introduce Jaspal Kaur. He is a counseling psychologist, presently working in Can Support as a senior counselor trainer. She has more than 20 years of experience. Today, she is going to uh, talk a bit for about 30 or so minutes about managing mental health during COVID-19. Uh, and after that, we have time for some questions. So if you have questions, please write them down and we may select to ask her. Welcome, Jaspal Kaur, and we look forward to hearing a talk. Before the talk of Jaspal Kaur, let me give a brief context of her talk. As we know, today is World Mental Health Day, and today is the day to talk about mental health. Because I think good mental health and well-being should be seen as equal, as important as academic success. We need to acknowledge the fact that mental health issue can impact anyone at any time. Not talking about mental health is literally killing society. We have seen many examples where highly educational qualified people commit suicide, attempt to commit suicide. Every 40 seconds, a person dies by suicide. If we see the Indian data, 132,000 people kill themselves every year. You will be shocked to know that 300 million people worldwide are suffering from depression. We have a report of American Medical Association which states depression cost companies for 4 billion per year in lost productivity. We know the fact that by 2030, it is predicted depression will be the primary cause of global ill health. When we talk about India, we have World Health Organization data which says India is the most depressed country in the world. A study reported in WHO, World Health Organization, conducted for the NCMH, that is National Care of Medical Health, which states that at least 6.5% of Indian population suffers from some form of serious mental disorder. But it's a matter of worry that we are not sensitized as the mental health is concerned. When we try to understand mental health, then we can see mental health is something which is very complex because it is determined by biology in terms of genetic factors. It is determined by behavior, which is psychological factors like diet, your smoking, alcohol consumption. It is determined by health service in terms of access to medication or vaccination. And mental health is also determined by social environmental conditions such as inequality, discrimination, pollution, and so forth. With the advent of this COVID-19 pandemic, mental health received considerable attention for the mass media. We are facing one of the difficult times of civilization. Health crisis to tremendous economic fallout. We are living in a kind of risk society with a sense of uncertainty and fear. Being a student of society and social psychology, I want to draw your kind attention towards the serious social cultural factor of mental health in the context of sociology. In that context, gender is a critical factor in mental health. Being at a stage of margins, women have to suffer more because of patriarchal societal structure. Women mental health is our last priority. With the consequence of COVID-19, we can see the rising number of domestic violence, sexual abuse cases, not only in India but worldwide. Because of the digital divide, lots of girls have to leave schools, colleges. Women have to work a lot, particularly working women. Most of women are facing a kind of sleep deprivation. And this is a very dangerous as far as mental health often is concerned. We can see COVID-19 magnified the suffering of women. Since women are the caregivers in society, so their health affects everyone's health. COVID-19 revealed the fact that not just capitalism, society suffers mental health too. Therefore, cultural factor is so important in that context. Now, we have understood that even many social scientists believe that mental health is a building block of women's empowerment. Another connotation of managing mental health during COVID-19 is related to our community. With a sudden dependency on internet and mobile online learning, mobile phone have become essential to almost every part of a person's life in these days. Psychological research is beginning to show that mobile phone addiction is a real thing, and our phone may be damaging our mental health in many ways. Internet addiction is one such thing, and with the advent of COVID-19, the growing dependency over internet actually has magnified the risk in that context. So we can see this is the another aspect of problem. Even psychological research reveals that we may think that our mobile phones are bring us close to our dear ones, but they can actually have the opposite effect. Checking your phone when you are eating dinner with your family or on a date with your lover, takes your attention away from being present with them. And this habit of virtual reality destroys the actual and real social bonds in many ways. I won't go into detail of this. However, this phone habit can cause psychologically, if we try to understand negativity, it cause it causes conflict and social isolation, which ultimately leading to mental stress. Excessive smartphone use can put your personal and professional relations at risk. But in this COVID-19 scenario, students have no option but to face risk in life. I have seen this thing, even my students' productivity and attention span of the classroom. Uh, and another very important thing is related to the cultural dimension of understanding of mental illness or mental suffering. If you talk about India, uh, we follow the culture of ignorance and irrationality when it comes to mental health. Persons who are vocal about any kind of mental health issues can be dismissed as weak, as inferior, as if broken guys who are more likely to ostracized for their honesty instead of rewarding for their bravery. We treat mental illness and mental health superstition. Uh, in order to give more psychological scientific insights on this very topic of today's webinar, that is managing mental health during COVID-19. Now I would like to invite Jaspal Kaur ma'am. Ma'am, over to you. Ma'am, over to you. Yeah. Kindly unmute your phone. Kindly unmute your mic. Yeah.
Good morning,
Okay.
everyone.
Good morning. Go ahead, ma'am.
I can't see my screen, that's what.
Okay.
Just a minute.
Just click the PowerPoint presentation.
Can you see? Can you see?
Just click your PowerPoint presentation. Just click.
Just a minute, it's not opening. Gautam, can you help me? Well, till the time I will keep talking. Welcome everybody for today's session. Today is Mental Health Care Day, and nobody generally talks about health. You see, health generally is thought about the physical health, right? But talking about emotions is generally very difficult. So I would like everybody to be very comfortable in talking about mental health. And Gautam has so well said that nowadays so many uh, children and so many you will be hearing up committing suicides, or they are unable to share their feelings, to share their anxieties, and most of us are at home. So the whole burden is on our telephones or our laptops. So I'll talk a little bit about myself. I work with a cancer organization called Cancer Pot, and it basically deals with the uh, cancer patients who are at the end of life. So you can imagine at this COVID time, what would be their stressors, that the treatments have stopped and all the government hospitals are now COVID hospitals. So um, their treatment is not possible. Some patients are very young whose treatment can be done, okay, but no chemotherapies, nothing is being done. So they have young children who are school going, who are college going, and they have lots and lots of issues. So I will talk in a very, very, I would say, a simple language where we can think about health. I think using the word mental also, people are a little alert that they should speak about it or not. So, welcome, friends. So, I will go back to my slides and start talking. So, the theme of today's mental health is kindness. So, kindness has the ability to strengthen human relationships. I think you believe in all of you believe in that. We all have compassion inside us, because whenever we see people who are suffering, who are having some problems, we are, heart goes out to help. And being college students, I think it is very important to be kind at this time, to help our classmates, to help our colleagues, help our family, especially, and especially children who are there. So all of you have gone through this lockdown. It's a very atypical time for college students as well as school students. You know why? Because the physical activity has gone down, and generally the spring season is very open. When people start going outside, they start interacting. But now, because of the lockdown, they all are confined in one home. And so because of being confined, the usage of phone has increased. So the sleeping hours have become very, very irregular. So you will see that there is mostly, it is a sedentary life. Sedentary would be like uh, there's no time for getting up in the morning. There's no time for sleeping. Mostly you all are on phone calls, or maybe playing games. Like I have seen people enjoy playing games, video games, but the screen addiction is a lot. But I wouldn't say that you should not, use your phone. But yes, very diligently you should use your phones, so that you even take part in other kind of activities. So I would say, what are the facts of lockdown? So many people wouldn't expect college students to listen to social distancing, because you all are young, and students generally want to socialize, and they want to go out and meet friends, they want to play, they want to do uh, picnics, or some kind of social activities. But this time, because of the lockdown, the government has made it very, very compulsory that everybody should stay inside. And it has happened. People have stayed inside. So, you know, the otherwise there were lots of other problems. And students actually understood the meaning of COVID-19, that the virus is very infectious, and if they start meeting someone, they can bring the virus home, they can infect their loved ones. So this time it has been more like they have listened. So the unresolved question is, if mental health and physical health will continue to a degree over time, will we see the recovery? This is a question. And then there is a question, how long that will take. You must be hearing that ठीक है, COVID cases are going down, but there will be another wave. We all are hearing that. But our bodies and minds have so much power that we don't use that much. Like just a few percent of it is used. So if we see a powerful mind, you will see that the lockdown also gives opportunities. So we have to listen and see what are the opportunities we are getting. So emotions that are faced by the students, so especially because of the COVID pandemic, you will see that people are lonely. Because of nuclear families, you will see that there are only 2, 3, 4 people inside the house. Therefore, the stress of the stress of the family, stress of your friends, they're increasing. Anxiety is increasing. Depression is increasing. And college students, especially because of their studies, because of their dissertation, their research work, they can't go to the library, so it has been affected. So, we have to use our coping strategies. Nobody talks about coping strategies. And this is the only way, which can help you improve your health, especially your mind, your body. Mind and body is very connected, you see. And there's a, connection of what you are thinking. What you're thinking, you will be feeling. The emotions are feeling. Your thinking will start working, and then you start acting. Suppose if we have negative thoughts, what will happen? Our mind will also think negative. So our actions will be negative. How? Suppose your mind is saying, no, I don't want to study, I just want to play PUBG, for example. And you start playing. You will not realize the time. After some time, you will realize that the whole time I have not used my energies in a good way. See, playing for half an hour or 1 hour is fine, it's okay, but we have to stop somewhere. So to improve that, we have to have some coping strategies. So I will definitely talk about the coping strategies also. So many of us are staying home. Social interaction and exercises have decreased. Negative, physical and mental health is affecting the person. And now I would talk about what families and people can do for their good health. I'll talk a little bit about self-care. What is self-care? Self means myself. I can do everything for myself. I can't let anyone else decide for myself. So basic self-care will actually improve your immune system. You'll be more strong, emotion-wise. You see, we have lots of reserves inside us. We don't use those reserves. We have to have enough sleep. They say nowadays that 7 hours for men and 8 hours for women. So you must be really thinking, why 8 hours for women? But yes, the research is showing that they are more active after getting this much of sleep. Eat well. Why eat well? You know, Generally what is happening is the because of our day-to-day life being affected, no routine, so we are eating whatever comes. People have stored so many things inside the house because of the lockdown, eating biscuits, chit chat, chips and all that. So what is happening is you're not eating well. Eating well, I simply mean that at least eat मौसम के जो फल और फ्रूट्स हैं वो तो खाइए, जो भी सीजनल हैं, eat seasonal vegetables, eat seasonal food. It is very good. And practice mindfulness. What is mindfulness? It is basically thoughts will come, they will go. Thoughts will come, they will go. When you are eating, concentrate on your eating. When you are studying, concentrate on your studies. When you are exercising, concentrate on your exercising. That is all. It is that simple. But yes, mindfulness we never think about. It it has come from a Buddhist, preaching, and it is very good. Sometimes we think that we are meditating. That means our mind is not thinking at all. But no, that is not true. Mindfulness meditation is also there, where we allow the thoughts to come, allow the thoughts to go, and you become relaxed. Breathing helps. That is the key. Breathing helps. If you are feeling anxious, anxiety, sit and just watch your breath. Just count your breath till 10. You will see the difference. Then you find activities. What are coping strategies? Coping strategies are those which you have learned when you were young. You know, children dance at some music. Music bajini, they will start dancing. And that is a very, very good coping mechanism. Then solving puzzles. Why not look for Sudoku, some crossword puzzles, and you will see your mind is really concentrating on something, and you will forget the other things what is going around. So you have to concentrate your mind somewhere particular and engage senses with hot bath. Suppose you're feeling a little, low or something, a bath helps. Sometimes a hot bath, sometimes a cold bath. It is just your choice. Even lighting a agarbatti, fragrance at home, it helps. Look for tasks you can postpone or simply eliminate from to-do list. Sometimes we make so many tasks that what happens is our mind feels, oh my god, this I haven't done. Maintain a diary, I would say. Write down your task, write down what you know is going on in your mind, and tick what you can do. There is no hard and fast rule कि ये तो पूरा खत्म करना ही है. No, do how much you can. Now let us come to how we can focus. You might feel unmotivated at this time. But remember, this time is for everybody. It is not just you. It is with everybody. Think like that. You see, the circumstances we can't change. When we cannot change our circumstances, that means we have to change ourselves. So the best we can do, the best would be to establish a routine. If you ever meet a counselor who's a psychologist or a doctor who's a psychiatrist, he will first thing he'll ask is, what is your routine? The routine should be fixed time to get up and no fixed time to sleep. Go to bed when you are sleepy. Don't wait for sleep on the bed. This will help you. You will see that your sleep will be very good at night once you don't decide on your sleeping time. But with your clock, your mobile phones, you can have a alarm and get up at one single time. It can be 6, 6:30, 7. It's up to you. Okay. And then after that, you can start working. Take breaks in between. ये नहीं कि 2 hours I'm supposed to study, so still 2 hours I'll keep looking at the watch. No, take a break. How does it matter? Go and have some tea or coffee or a glass of water. Okay, then and the third thing is separate your sleep and workplace. Sometimes we just have one room, you see, but still we can have a table. We can sit and then do our work. But the sleeping area, we should not generally eat there. We should generally sleep there. That's the bed will always meant for sleeping. In the olden times, you would have seen that people used to make beds. They used to have a charpai. They used to make bed. That means their mind, they are giving that signal to the mind that this is a sleeping time. Okay, so that's the only reason. Or if the family is saying something to distract you, always use the word I. I am not feeling fine. I am worried about the exam. I am worried about anything. The moment you say I with the feeling, people understand. You have to use that word. Okay, so work together to develop solutions. You see, in the family, you have to discuss. Suppose I am very, very tense because of the coming exams, class is not going on. Talk with your family, talk with your teachers, and this virtual communication has helped. Earlier, children used to say, "Why you always tell us not to use phones?" Now we are using phones for our studies. So the things have changed suddenly. So this virus has actually taught us so many things. So develop support system. This is very important. You see, sometimes you feel lonely. Always think about with whom I feel comfortable, with whom I can talk. You have so many friends scattered all over. You can't meet your classmates, but you all can fix up a time. Let us have a Zoom meeting, let us have a Google Meet, and together let us talk what everybody did. Half an hour, 30 minutes, 1 hour. It will give you so much relaxation that you can even ask questions. You see, I can't do this. You help me out in that. So these ways are probably you will come out with some kind of a solution, because nobody will give solutions. You have to find it from inside, and we have that ability. Then even something as simple as turning on your webcam. Sometimes what happens is people don't on their webcam because they feel, अरे कोई मुझे देख लेगा, देखेगा तो क्या सोचेगा, how I am dressed up, how I am looking. No, be comfortable with yourself. So what? If you are in your night dress, so what? It doesn't matter at all, because you are at home, you're in your home dress. Feel very, very connected with yourself, with your emotions, and you will see that makes a difference. Then one is helping ourselves. Once you help yourself, then only you can help others. You must have seen during these COVID times, there's so many people who have been helping others. Big names they can do, like Sonu Sood or others. But even we as people who can just ask, for some ration help for others or some kind of help. Suppose a student who is poor doesn't have a phone, you call that student, come home, but this 1 hour you can use my phone. So what happens is that small help that you provide for others, you'll feel happy from inside. Okay, teach a student, you will see the happiness. Whatever I could do. Okay, don't think of big things. Big things mean nothing. Sometimes it is show off, but when you're doing from your heart, you know what you're doing. Then classmates and family members are very anxious. You don't have to fix problems. You can't fix anyone's problem. Okay, you can only fix yours. If you're a psychology graduate student on a clinical track, helping patients manage the same anxieties you are facing. Remember, anxiety is what others are facing, even a psychologist is facing. First, handle your concerns, then talk to the patient. Otherwise, you will not be able to help. Mind management. Find ways to manage disappointment. ठीक है, internship नहीं हो रही है, dissertation I am not able to present, and graduation ceremony nahi ho rahi hai. I was supposed to be getting a certificate, and important events in this year I will not be able to attend. Even a marriage in the house, you see, and even a death. You won't believe that in cancer support, there were lots of patients who had come from different states to get treatment here, and they got stuck here. And we see patients at home. Doctor, nurses, and counselors, they visit the patients at home. So the palliative care, that is end of life care, when cure is not possible, care is possible, we were going inside their house. So you see, even in their death, they couldn't meet the families. Sometimes children were not there, or the parents were not there, or parents were dying, and they couldn't go back to their villages. So they were these virtual calls made a lot of difference. They could speak to their loved ones, and even puja ceremonies were performed virtually from their pandits. You see, your belief system is something very different. It is very, very personal also. So think about those people, and you will see our problems are, you know, for the time being, it's a problem. It will get sorted out. Virus is not going to stay. कहते हैं ना, this time will also pass. So think of that. So grieving those losses. Grief is something which we all, feel when we have a loss. So whatever loss you feel, if you are feeling grieved, be in that thought. If you want to cry, cry. If you want to speak out, speak out. If you want to share, please share. This will help you reframe your thinking. This will help you to, relax. So think about how you can honor what you have achieved. Whatever achievement has been done, say, yeah, see, I did this. Pat your back. Sometimes it helps patting your own self. Find new ways to celebrate, So how can we celebrate? Suppose we are in the house. People even started cooking. They start making cakes, they start making breads, they learn to make something different. Celebration is a very personal thing. You can celebrate in any way. Okay? So something for celebration helps. Even in the family, clapping helps, laughing helps, playing cards help. So please do that. What to refrain from? Yeah, this is the most difficult thing, Lot of media consumption. You will see your pack is over very soon, and you are overdoing things. Be careful, okay? And avoid substance use. This is the time where, the ages of 18, 16, 20, 21, they resort to substance use. It could be anything, alcohol, maybe, smoking, or any other substance. So please, if you are going in that mode, take help. There is a lot of help, okay? And it's good to stay informed. You see, information is everywhere nowadays. But what is happening is media is giving so much information which is giving us anxiety, and we are feeling overwhelmed. You're seeing deaths. They are showing what is happening. People dying in the hospital. They are not able to meet the family. They are performing their last rites themselves. And, we get connected to that pain. Try not to. But yes, if someone is going through this kind of a situation, please be there. Call, talk to them, and believe only in what WHO is saying, and like Centers for Disease Control and Prevention is saying. Only those reputed sites which are giving us information, believe in that only. Then management of crisis. Focus on things you can control. Which you cannot control, yes, you have to divert your mind. That is why I always keep talking about, coping skills. So your classmates, friends, and family members may be disobeying the rule of physical distancing. This may create a lot of stress. Tell them, no, it is for some time. Let us not. Let us protect our, family members, our parents, our grandparents. They will listen to you. So while modeling good behavior and staying safe yourself, recognize that you can't control what other people do. You can only control your thoughts, feelings, and behaviors. Wearing a mask, washing hands, talking from a distance. And what I would say is, suppose one of your family member is infected with COVID. They are supposed to be quarantined. It's okay. That doesn't mean lock the door, close the door, nobody can even see them. And earlier, how they used to pass the plate and all that. But what we have seen, we are seeing COVID patients at home, because you never know who is COVID positive or not. But we take our precautions by wearing a PPE and a mask and gloves and everything. But seeing patients. But in your home, what you can do is, you can tell them, you sit on a chair and I'm sitting outside the door. Let's talk. Okay, with your mask on. You can communicate. खाना दिया है, उसके बाद में they can wash their plates and keep it outside. So what? You see, there are many ways you can handle the COVID-19 situation. So in your home, they don't feel isolated. They don't feel alone. Otherwise, in hospitals, you see, they can't meet anyone. That is why home quarantine, home isolation has been suggested nowadays. Now let us talk about the coping strategies. Always coping strategies are what you do during crisis time. Crisis situations always create opportunities. Remember that. So find in you what opportunities you are getting. Recognize that. Okay. And go to your childhood. When you were when you used to finish your study, you used to go for playing with your friends. You used to play badminton, you used to play carom board, you used to play ludo, or listen to music, dancing, whatever relaxed you. Small things, okay? Even, gossiping, reading, chatting, breathing exercises, learning to cook, this helps. So self care is very important. So coping skills, everybody, please go inside yourself, go to your childhood and see what made you happy. Even now those things will make you happy. Believe me, you will find something. you know Gardening, meditation, and this is a wonderful way of getting relaxed. Go up, chat pe jao, sit for some time, watch the sky, and then close your eyes and see how you feel. Jogging. This now you can do. Earlier, you were not supposed to, but people took chances, and at night they used to walk in their lanes. Fast walking. That also relax. I've seen so many older people walking in my lane at night. They were wearing their mask and they were walking. Then prayers. Prayers are very soothing. Anyone who believes when to pray, what to pray, whom to pray, personal choice. You don't need to say to anyone. But yes, if you hear about someone, pray and say that God, usko theek karna, may his soul rest in peace. These are the things which really helps. A good night's sleep. As I told you, don't break your routine. Fix time, getting up, sleep when you are feeling sleepy. This will help. Puzzles. Lot of people feel very relaxed listening to puzzles. And Jagjit Singh is amazing. I personally love listening to puzzles. But yes, you may be, you know, liking to listen to songs, pop music, soft music, whatever. Then gardening. Even small pots. If you have a flower coming out, if you have a two, four, five karelas coming out of your gamla, you will see what people are doing. You won't believe. This is the time what I'm seeing around me. People are really potting. Very, very beautiful flowers. This is the flowering time, and lots of flowers are blooming. Being a part of a support group, you know, holding each other's hands. Our CAN support motto is this: we hold each other. The doctor, nurse, and counselor, they work in tandem with each other. They visit patients, the family members, patient who's about to die, and during this COVID time, there's so many anxieties. We sit and talk. But counselors, we all have our phone calls. We talk to them, and virtual. If you want to see the patient, we tell them, please on your camera. If they don't have, we ask some neighbors to get your phone, and we will speak. So you have to find ways. There is no other way. So helping each other and being a part of a support group, it helps. So thank you so much for listening to me. But these were the very simple things which I talked. But yes, you all can do well. And yes, when the exams comes, you all will be doing very well, because self study makes a difference. In the class, yes, you do meet your people and you feel good. And later on, I'm sure after December the colleges will open, the things will come back to normal, and things will be fine. Thank you so much. So over to Randhir. Thank you.
Thank you so much, ma'am. You really gave the very insightful, right? Because these days the question of mental health is really significant and how to be healthy mentally. In that context, our thoughts and our feelings have an electromagnetic reality. So you really gave very insightful, understanding like how we can use our time uh, wisely, right? So and you really well like crisis in a life opens up the possibility to difficult destinies as well. During rough time, you really they very scientifically way to correct yourself, right? How to inculcate kindness, how to inculcate solidarity in context. So, as an individual and a society, it's uh, entirely possible to change our brains to attain higher level of attention, awareness, happiness, peace, empathy, compassion, patience, joy, and contentment. And a higher level of mental health is absolutely attainable even in the time of crisis. So thank you so much, ma'am. And now I would like to invite questions. So student, if you have any questions, you can directly ask to her.
Yeah. Good morning, sir. Yeah. Good morning,
Oh,
ma'am.
good morning, good morning.
Yeah. Okay. Ma'am, your mic is off.
Okay.
Yeah.
Okay. Ma'am, I have one question with regard to students that actually we are taking exams for the student. Right now they had a midterm exam and they are also going to have another exams. Okay. So taking exams of the student in this particular period of time because they are at their home. They are facing this certain COVID problems. Okay. There are certain students who were actually COVID positive. So taking exam, whether it is putting mental stress on this mind or not, whether it is a good thing, whether we are doing a good thing, we are seeing that the education is important, taking exam is important, but is it necessary at this particular point of time to take this exams? Whether it is imposing a mental stress on them, that whether there is possibility that this particular thing can be postponed because it is not the good time, according to me, it is not the good time to take exams because they are not in that mental state of mind to study and grab all things. So can you please
Right.
elaborate on this particular
Thank
thing
you,
that
Yugandhar.
what should be the mental state of mind if they want to give the exam? Okay, so what? Yeah, thank you.
Okay, thank you, Ginder. I think you are very right that at this time taking exam is a big problem for the teachers also and for students who want to give the exam. But you know, Yoginder, sometimes the policy makers they are not in our hands. I told you, na, that policies are made by the schools or the colleges. We feel that it should not be done, and exam should never be a criteria for a person's intelligence, but because if it is a policy, then you will have to abide by that. But yes, if you do think that this is possible, if you don't take exams and you know that the child is performing well, and if the schools and the colleges are willing, if you speak to them, I think maybe definitely something can be done. Some schools are doing that. They are saying ki, there will be no failures, but yes, just so that the child feels that I have given. Even children feel very stressed out that they are not giving exams, right? But if a child is sick or has been COVID positive, and later on his his physical mental levels are low, so if you cannot give that much, you be a teacher who gives that kind of a freedom. It's okay, this is a difficult time, but yes, we can do something like a lenient marking, or we know that the child is really he wants to study. Don't I think do a failure thing. That is important. So if the policy is saying you have to take exam, then you can't change it. But yes, you be from your side, you do what you can. Okay. Does that answer your question?
Yes, ma'am. Ma'am, I also want to ask one more thing, ma'am. When they are going to give exam, okay, when they are giving exam, they have to prepare for a whole day. So how will they prepare their mind with respect to this? Okay, I have to, because in this particular period, I don't think anyone can study for a whole day
Yeah.
because they have to prepare for exam. For exam,
Yep.
they have to study for a minimum 3 to 4 hours. So I don't think
Absolutely.
their mind is right now. Their mind is in that state that they can study. So what can they do for the purpose of this thing so that their mind can be in that state to prepare for the exam?
Right. Thank you, Yugender. Yugender, you can do one thing. You speak with the child, because you are the guide, you are the teacher, and the child will listen to you. Just tell the child that not to be anxious. It's okay. How much you can study, it's okay. How much you write in the exam, it's okay. If you give that confidence in the child will definitely relax that my teacher has trust in me, and I can study. Whatever is possible I can do. I told you, now always tell them, do what is possible. Okay, the moment you give them that freedom, they will use it nicely. Otherwise, sometimes what happens, if we just tell them, acha sab chalega, ho jayega, aisa, no, not like that. You have to say, it's okay, this is the difficult time, let us study for this much time, and quality studies is more important. And examination, yes, because it is compulsory, you have to give your exams, you give it. We know you are a wonderful student. Give him that encouragement that you are a wonderful student, you can do it, you will do it. This is what Yoginder, you should do from your side, and the child will relax. I told you, what message you give to the brain matters. So when Yoginder is giving that message to the child will feel relaxed, the anxiety will come down, and he will feel, okay, I can study also and I can give my exams also. But don't give push. ऐसे करना है, इतना लाना है. Tell their parents. I think child does not need counseling. Always their parents and the teachers need counseling. Okay, Yoginder. So first,
Okay.
you think about it. Talk to the parents also. So that will give a lot of, that will make a difference.
Okay.
Okay.
Thank you, ma'am. I will surely follow your guidance and
Yeah.
instructions. Thank you very much.
Absolutely. The
Thank.
parents are generally very, very imposing, and they say, अरे मेरा बच्चा तो ऐसा नहीं करता, वैसा नहीं करता. You tell the parents. Okay.
Mhm.
Yes, ma'am.
Thank you so much.
Thank you, ma'am.
Any other student? So I think we're running out of the time. So thank you so much, madam, uh,
You're
for
welcome.
giving such a well talk on this topic. So you can leave this